To be here. So yes, let's get kickstarted. We're going to talk about music therapy today, how music can be impactful in the clinical world, and just in general, the healing powers of music and the elements of music that make it healing. So my background is kind of a little told already, but I'm a PhD candidate at Colorado State University. I hold my master's in public administration. I'm a neurologic music therapist and a board certified music therapist. And I like to include my background in the military because it's a huge reason as to why I became a music therapist. I mean, it will come up in a couple aspects during this presentation today and what led me to focus on what I focus on as a music therapist. I'm the director of music therapy internship at Silverado Beverly Place, co-owner and internship director of music therapy at Music Matters Inc., which is a private practice that my business partner and I started together. And I specialize in trauma care, memory care, and neurologic music therapy. The trauma aspect being something that was gained from my experiences in the military, and that led me to wanting to specialize in that area. So a little bit about what we're going to go over today, what music therapy is, the principles and the various aspects that make it music therapy, what neurologic music therapy is. We're going to talk about dementia, memory care, and music therapy, how we do music therapy and use it at Silverado, and music therapy inspired intervention. So this is kind of something that non-clinicians can focus on, or non-music therapy clinicians, how they can incorporate music therapy into things that they're doing while not being a music therapist. And then we'll talk about some of the resources and where you can look for things music therapy related. And then we will have time at the end for questions. That's one of my favorite parts of this whole presentation. So I'm going to kind of give just a brief overview of everything so we have more time to talk at the end if you have anything you'd like to discuss. So what is music therapy? Music therapy is a clinical evidence-based practice of music interventions. The focus here is we're accomplishing individualized goals. They're non-musical goals. It is conducted by a credentialed professional who has a board certification designator, which is MTBC, Music Therapist Board Certified. And this is from the American Music Therapy Association, which is our governing body. These non-musical goals are focusing on physical, emotional, cognitive, and behavioral domain areas. And we'll go into a little bit details later of what those domains look like. Something I like to point out, to be a music therapist, what we're really doing is intention, replication, and consistency. So we're trained as clinicians to do these things multiple times with consistent results using the elements of music that many musicians may know and be familiar with, but we're trained to use them in a clinical manner for clinical value and outcomes. So what is a music therapist? To be a board certified music therapist, you must complete a bachelor's degree or higher in music therapy from an American Music Therapy Association, AMTA, as you might hear me refer to it later, approved college or university. Clinical training and internship. So within the university, a music therapist will do about 180 practicum hours before they even start their internship. And then they will do an internship, which is 6 months. And I'll talk a little bit more about what that looks like later. But these steps must be completed to get their degree. And then once they complete their clinical training and internship, they can apply for their board certification, which is a test, an exam run by CBMT, Certification Board for Music Therapists. This is the other organization that kind of runs our licensure and certification aspect of our profession. And that once they pass that exam, they are a board certified music therapist. Each state has some specific requirements. Some states have licensure, which is really beneficial because a lot of times with licensure, you can work with insurance. Like states like New York, Pennsylvania, there's a couple others I think that have licensure, and many states are voting on it for it to be implemented for this profession. And then to sustain that sport certification, a music therapist must continue their education with professional development. We call them CMTEs. And these are courses we take to keep our knowledge and learn about new techniques and our continuing education aspect of our profession. I think you need about 100 credits every 5 years to recertify. So music therapy principles. So we're going to talk a little bit about the things that make music therapy what it is. And I'm going to talk about the ontology of music and how it's used in music therapy. So you see this Venn diagram and this triangle, but I'm going to really emphasize this triangle. It is not music therapy unless every one of these triangle points are met. So we have music, client, and therapist all must be present for it to be considered music therapy. And within this music therapy triangle, we have some techniques and things we use to make the session what it is with clinical values. I'm going to talk a little bit about the container. So the container of music, we're providing a structure for the patient or the client to operate within the session. It's kind of a guide stone, a guide way for what we're working on, the goals and objectives that we have selected in the treatment plan. And we structure these sessions in a container with a beginning, a middle, and an end so that we can focus on those outcomes. And within that session, we use entrainment. It's one of the big techniques we use. It's an aspect of music that we all are familiar with. Entrainment is when two people or two entities lock into phase within rhythm or harmony. And a way that everyone's kind of been exposed to this is if you've ever been at the gym or you've ever been out in public or even just listening to your Spotify playlist and you start tapping along or tapping your foot or just kind of bopping your head, you're in training to the rhythm of the music that you're listening to. And a lot of times with musicians, they'll entrain to each other when they're playing together. And if they don't, you'll hear it. It's very apparent. And oftentimes the audience listening to the music and trains with the musicians that are playing. So this is a technique that we really focus on how to engage our patients and clients in our sessions. And another principle and aspect we use is motivation. I see this a lot when I work with physical and occupational therapy, PTOT. A lot of times the residents we're working with, they don't necessarily want to exercise. It's not necessarily a fun thing for them. But when we include music, it starts to motivate them, to encourage them, especially if it's a song that they like or they listen to. And we see this a lot with anyone really going to the gym and listening to music. It's very different to go work out without listening to something music related when you're there. That aspect, that encouragement value, we use that to work on our goals and objectives. And then the most important aspect of music therapy is ISO principle, and you're going to hear this a couple times today. ISO principle is we meet our clients where they are at in the moment every time. This is huge. We come in with a lot of planning. We do a lot of session planning. We come in with a big thing where goals and objectives, we're going to hit these markers, and maybe our client isn't there that day. We meet our client where they at every single time, and we go from there and work towards the goals and objectives. So this is a huge part of what we do. And so the process for music therapy, so it's a referral basis. So step one is the referral process. Now, clients, patients, they can self-refer, and we often do have someone walk in and be like, I would like music therapy. Oftentimes it's their family or their loved ones or their friends. Many times it's other clinicians. We get a lot of referrals from neurology, especially because with neurology, we can use CPT codes if they write a prescription and work through insurance. So there's a lot of referrals from clinical professionals. Where I am now, when I work with Silverado, we do PTOT referral and we work with physical and occupational therapy as co-treatment. And then yeah, so the referral process is a huge aspect of it, and that's what kickstarts this whole process. And then we get into assessments. So we will do a very in-depth assessment where we're gathering a lot of background information, medical histories, likes, music preferences, past diagnoses, things that they're working on, anything really it's valuable, we use it to create our treatment plan. Our assessments are pretty in-depth. We spent a lot of time on them, and they really help kind of gauge where we're going to go and what goals and objectives we're going to work on. And in the assessment process, we absolutely, if they are able, we include the client so that they can be a part of that treatment plan. Because each music therapy treatment plan is really designed for the individual, and every single one is different for every single person that's being treated. And then so we get to our treatment planning phase, and this is where we're identifying goals and objectives. Goals being broad domain areas that we're working on, examples being fine or gross motor, cognition, emotional processing, attention span. These are goals, and our objectives are specific ways that we're going to achieve that using music therapy interventions, but the goal is a non-music therapy or a non-musical goal. And then those interventions, we will implement them within the session. And then the evaluation process will determine if we keep them, change them, how we're using them, the frequency. Evaluation and reevaluation happens in many different ways, but I find the most effective tends to be the quarter system. Every 3 months, we will evaluate or reevaluate unless there is a change in condition, which we will do it sooner. Some do semi-annually, but the more frequently you do reevaluation, the more successful your interventions will be. So let's talk a little bit about the different kinds of music therapy interventions. So there's really 4 main categories, and there's many, many interventions out there that we use and techniques that we use, but they all really fall into these 4 categories. So we have passive listening. So this is where we're doing activities or just listening to the music, but we're not physically engaging in the activity of making music. An example of this is just listening to a song you like and then maybe talking about it after, like a lyric analysis would be an example of passive listening. Active music making, we're taking an active role or ownership in the intervention, in the activity that we are doing. Live music making, or we're doing an activity that's music in nature, playing a shaker along to a song. So now we've taken it from just passive listening to active listening by playing an instrument while the music is going on. Active music making is a big part of what a lot of the music therapy interventions are. And it's been proven to be very effective. And this really is something anyone can do, any client can do, because music therapy is designed for non-musicians, although there are benefits to working with musicians as well, techniques we can do. But the entire design of this profession is to work with the non-musician, but using music because we all have a relationship with music. Improvisation. So improvisation is a really fun one. This is an area that I like to focus on a lot. Being in the moment, being present, and processing that. Huge aspects here for emotional processing, for PTSD, for just giving someone the space to be when they need it, and the therapeutic value that comes from that. A really cool activity I like to do, I do this in rehabilitation houses, teen and adult drug rehab. One of the great activities we do is we write a blues. We'll bring in something with some blanks, give them some structure, and we'll write a song, pick a theme. And through the process of this blues, we'll pick a key, and I'll give them that choice. And again, this is designed for non-musicians. And I'll take an iPad with GarageBand, which is a recording software, and you can program the keyboard in that program to a specific pentatonic scale in a key, which basically means you can't play a wrong note no matter what key you hit. And so we'll let these non-musicians take solos and improvise during this blues and talk about it after, how they felt during it, what thoughts and provoking things did it bring out to the theme that we were working on. And it's amazing just to see them just kind of have fun with it and really let themselves be in the moment during those times. So that's a cool way that we use improvisation. But another very common way is drumming. If you play like a single drum, which like a drum circle, drum fit, we'll talk a little bit about that later. Drumming is improvisation. You don't really have it planned out. You're just playing the rhythm that you feel to what you're hearing. That's improvisation right then and there. And then we have composition. So we have songwriting, original creation, or we're rewriting things. Composition has a lot of positive impacts for emotional processing, for communication. Just giving someone the space to write what they're feeling as opposed to saying it. Sometimes that's easier. Sometimes it's better to put it on paper than to say it out loud. But then once it's on paper, we can talk about it and say it out loud, and it gives that space for that. So we use a lot of composition work in music therapy. One of the ways we do it too is piggybacking off songs that they know. We'll like cross the words out and change them. An example I like to give is like Eye of the Tiger. We can take that chorus and say, it's the blank, Eye of the Tiger, but we'll take that out. It's the blank, rising blank, or we'll change the words, and we'll give them the ability to put in there what they need it to be for what they're going through in the moment. And you can do that with any song. So a lot of times we'll ask, what songs do you like? What do you want to listen to? And we'll take those songs and turn them into a songwriting process. So I want to talk a little bit about neurologic music therapy. It's one of my specialty areas. Neurologic music therapy is a subspecialty of music therapy. So here in neurologic music therapy, we're using the elements of music that we already use in music therapy: melody, rhythm, timbre, dynamics, tempo, cadence, all these things about music that engage us, that make us want to be a part of that music. And we use it to develop neural pathways and improve brain function, stimulus, and neuroplasticity. In some aspects, we're working on cognitive behavior function. But the cool thing with neurologic music therapy is it's really focusing on the brain, and it's intentional and it's repetitive, and we get the same results often. And this is designed off 20 standardized clinical techniques, which I'm going to talk about a few today that are very commonly used, especially in memory care. But this neurologic music therapy is very well-researched, evidence-based part of music therapy. So techniques that are commonly used, especially in memory care, I want to start with rhythmic auditory stimulation, or RAS. So we're working on rehabilitation of movements. A big focus of RAS is gait training or gait work and ambulation. So what RAS is doing, and you're going to see an example of this in a little bit in a video I'm going to share. We are encouraging the patient or the client to sing out the rhythm, the melody, or to hum it out while making movements to that rhythm. So the act of physically intonating it encourages that movement and trains them to the movement that they're working on. We see a lot of improvements in gait training. So we'll take something that's very common, like duple meter, very common standard pop music cadence, right? You got your 4 beats, and we'll entrain them to those beats and then put it to a walking gait cadence, and they will walk in time to the music, similar to the way that we tap our foot when we're listening to music. And so we use that aspect to get them to work on their gait. We're going to talk about therapeutic instrumental music performance, or TIMP. So here we're working on movement and exercise and stimulation function. This is often paired with occupational therapy. And a big way that we do this is those functional daily life movements that a lot of our memory care clients or patients need to work on. We incorporate some kind of musical component to it to help encourage those movements. An example being the reaching out and grasping. So we'll use a paddle drum. We'll have them reach out and grab the paddle drum, and then we'll move the paddle drum and they will play to it. Or they'll reach out and grasp a mallet, and we'll move the paddle drum and they'll hit the paddle drum as it goes from the person that's facilitating. And so now we're working on those grasping, fine and gross motor, movement, crossing midline. There's a lot of clinical aspects that we can use TIMP for. You'll see an aspect of this also in a video later. Melodic intonation therapy being the third. So this is a really interesting one. This is used a lot of times with expressive aphasia for rehabilitation. We're basically using the ability to sing, which comes from a different part of the brain, and helping it to facilitate speech throughout just regular speech, not singing speech and melody speech. And a big case that made this famous was Gabby Giffords when she was shot in the head. And they worked with a neurologic music therapist, a neurologist, and a speech therapist to help reteach her how to speak. And there's a little graphic here in the upper right corner where you can kind of see the brain on music, and the brain with language, and the brain at a resting state. And you can see in the middle two, especially, language is on the opposite side of the brain, and then music is on the right side there. So left side, sorry. So you see that in the area of her brain that was damaged, they were able to teach her to speak through singing by using a different part of her brain, by rebuilding neural pathways. And it's very well researched and documented. It's a really interesting case to look at if you feel so inclined. And then pattern sensory enhancement, PSE. So here we're using rhythm, melodic, cadence, harmonic, dynamic elements. The real difference between this and TIMP, or this and RAS, because they're similar, is this is all about cueing. So now we're using musical cues to motivate and inflect movement and work on functional exercise and activities of daily living. This is also a technique that is used often with occupational therapy. So we'll talk a little bit about dementia and how music therapy is used in dementia. I know most everyone here is familiar with dementia, but for those that aren't, it's a general term that refers to the impairment of memory, cognitive function, and decision making. And it's more prevalent in the age of 65 and older, but we are seeing an increased amounts in younger populations. I think I read a case that was as young as 33 or 32 or something like that. And dementia can occur in anybody. And by 2060, 14 million adults in the US will have some form of dementia. And there currently is no cure. So it is something that is very prevalent to our society. Different types of dementia, Lewy bodies, vascular dementia. I've seen a lot of diagnoses lately with mixed or unspecified dementia, Alzheimer's, and then frontotemporal dementia. And a really interesting aspect about working in a memory care facility is that we see all these different kinds of dementia every day and how the various techniques we use, how they function with them. And it's just really kind of interesting and rewarding to see how you can work with these various aspects of dementia. And something that just kind of blows my mind every time is just the way that cueing and rhythm can inspire consistent change when people can't remember anything else. I just last week I was working with a resident who didn't remember my name, didn't know why we were there, what we were doing, but when we were playing a song, there was this specific rhythm that they would do every single time to this part, and they remembered to do it without any prompting, without me demoing it beforehand, and they can't remember much else. So it's really interesting how music and the rhythmic aspects of music, the melodic aspects of music, they stay with us when we start to forget everything else. So a lot of times we use this with short-term memory issues. Music therapy in dementia. So a lot of times in dementia, we hear quality of life, and we do. That's part of one of the things we work on. It's one of our goals, improvements in quality of life. But something that I really got to experience in Silverado is increased and improvements in various domain areas that we're working on. It's really amazing, and that's largely due to the culture at Silverado, which focuses on their Nexus program. The whole theory is that if we approach it a certain way, not only can we slow the progression, but in a lot of ways we see improvement, and we do see this with MMSE scores and things that we're measuring, that there's actually improvement in people with a neurodegenerative disease. So we see increased participation and attention span that sustains for a fairly long time before the progression of their disease changes. We see improvements in communication and socialization. We see increased ambulation and walking gait, very particularly with physical and occupational therapy. This is a big one. We see increase in cognition. We measure MMSE scores every couple months, and working with music therapy, we've seen improvements in their ability to remember and their ability to answer questions. And there's a lot of really wonderful stuff happening within that. We see improvements in mood and emotional processing. A lot of times, this is one of the very few interventions where they feel, people participating feel like they can express themselves. And it's through like that musical aspect of just being in the moment and being able to share. A lot of what we do, we process while, during, or after. So a lot of that processing works with mood and emotional processing, and it comes from that musical motivation, that encouragement that we talked about earlier. And then we see improvements in quality of life. Well, of course, that is a focus as well. But one of the things that's just really interesting is that we do see improvements in a lot of areas that I feel that are assumed to not be improved. So we have a person-centered humanistic approach. Love is greater than fear as one of the big staples of Silverado, and it's really prevalent in everything and all the work everyone does every day. A really cool thing about Beverly Place, Silverado, is that it is the only place with a full on-staff music therapy program that has an internship, and we'll talk a little bit about that internship later. But there aren't very many places like it, and so everybody gets music therapy every single day, all day, and we do both groups and one-on-one and co-treatment sessions with the interdisciplinary team. Our clinical approach is geared towards improving cognitive function, language and memory recall, maintaining social skills, and providing quality of life. And a cool aspect too is everybody participates in music therapy. It's not just our residents, it's our caregivers, it's our family members, it's our staff. Everybody is part of it. And the musical interventions address anxiety, depression, agitation, aggression, isolation, and other behaviors. And I like to mention here too that this is where that trauma aspect comes into play. a lot of times with memory care, this is my experience, what I've observed is there is a lot of trauma here because while many times they don't know that they have dementia or some kind of memory deficit, they know something is happening. They know something is different. And even if it's just in the moment of realizing they're forgetting the last thing that they thought, and that comes out in a lot of these domain areas. So we kind of treat everybody like a trauma case. They are a trauma case. And that we've seen a lot of success by doing that at Silverado. So I'm going to show a video. It's a 3-minute video. It kind of just sums up a case that I worked on for co-treatment. So with physical and occupational therapy using neurologic music therapy techniques, a lot of what we talked about earlier. And I'll, after the video, kind of point out certain parts that were very noticeable. We're going to talk about JW. JW's family consented that we show this video for clinical and educational purposes, and we just refer to the client as JW. JW is 66 years old. He is a musician, and we'll talk a little bit about how we were able to adapt techniques to incorporate his musical abilities. He was diagnosed with Alzheimer's in 2019. He struggles with anxiety, emotional expression, and ambulation of his left knee. So goals, we were recommended music therapy for both one-on-one and co-treat with PT/OT. The goals for the one-on-one were increasing emotional expression and reducing anxiety. So we did a lot of improvisation, a lot of song analysis. And then the goals for co-treatment was increasing balance, gait, and knee strength.
Good.
Yeah, tell me about it.
Oh, I just feel free.
Free.
Yeah.
It's a good feeling.
Yeah.
So that was JW. Before we go on to the next slide, actually, I want to talk a little bit about what we saw there. So a lot of neurologic music therapy techniques that we had discussed previously. Same with some emotional expression, some lyric analysis, songwriting, improvisation. Um, the paddle drum video, or that aspect of the video, that is a great example of TIMP, therapeutic instrumental music performance. So we're using the paddle drum to facilitate balance and movement. There was tape on the floor by his feet, so he was standing in a stance, but we were getting him to move, cross midline, shift his balance as he was moving. With the walking, we started from scratch where he was sitting or using the walker. We kind of rebuilt the strength and function with his knee, starting with knee high and then kicking out the mechanical movements of walking, and then balance. And then over time, we took the walker out and we had a weight adjustment belt on him. And then after that, we took that away and he was just kind of using things to the side. And then eventually he was walking without any assistance. And so we kind of had a very systematic process in how we approached that. And then the end, the emotional expression, the improvisation at the end. He says he feels free, and that's such a wonderful moment. But for me, what gets me every time is after he says that, there's that sigh, that pause, and he just sighs, and that kind of just sums up what a lot of times with music you can get that freedom, that being present in the moment and escape from everything else and just be there, and then be able to say what you feel, to really just be there and share that. That can be very relieving. So we're going to talk about the internship at Silverado. So I'm the director of the internship at Silverado. It's a American Music Therapy Association nationally approved internship site. So we have every quarter we take 2 interns for a total of 8 a year, and it's a full-time internship, 1,200 hours. So it's 40 hours a week full time for 6 months. And our interns facilitate groups, one-on-ones, and co-treat with PTOT. A huge thing we focus on this internship is being a clinician. Our interns spend 2 to 3 weeks being very extensively trained, and then we have them start leading and facilitating. The goal is that they spend 5 months of their 6 months being a music therapist, so that when they go and get their board certification, they can jump into the real world ready to go, understanding how to conduct their craft. So a lot of the objectives that we really focus on is documentation. We really emphasize this because it's a huge part of any kind of clinical profession. So we work on chart notes. They learn how to assess, how to write an assessment, how to chart with other clinicians, how to read charts from other clinicians in the chart room, and how to use that information to help inform their treatment planning. They learn how to write an extensive treatment plan, a session plan, how to design music therapy interventions, how to use those interventions and those elements of music to achieve the goals and objectives that we're working on, because that's really what sets the difference between a musician or a music healer and a music therapist, is those skills and understanding of how to take those aspects of music and use them in the clinical field. They learn how to implement those interventions and how to change them as necessary, especially in the moment. One of the hardest things I think about being a music therapist is going in with a plan, having that plan thrown out the window, and having to take everything we know as clinicians and in the moment recreate interventions to be successful with our clients. Because a lot of times that things just don't go according to plan. And then they learn interdisciplinary or evaluation. Sorry, I skipped evaluation. They learn evaluation, and reevaluation is a very important aspect of it, because we need to make changes when necessary, especially if there's improvements, or if there's not improvements, we might need to change our thought philosophy and how we're approaching the goals and objectives so that we can achieve them. Sometimes we need to change the goals and objective. So they'll learn how to do that, and they learn interdisciplinary collaborations with many other clinicians, including physical, occupational therapy, speech therapy, neurology, nurses, everybody, caregivers. They learn how to work with everybody. And then to finish their internship, they will complete a research case study, which they'll spend 2 to 3 months working with an individual. They have a caseload of about 5 and they will pick one to be their case study, and they will do research on the interventions and the goals and objectives they're working on with that resident and present it at the end of the internship to their professors and advisors at their school and their university, their friends and family, and us at Silverado. It's a really fulfilling project that really, I think, take with you after you finish your internship, and it stays with you forever. And it teaches you how to run a research case study. And because of all these research case studies, we get 8 a year. Silverado gets to stay at the very forefront of music therapy research. A lot of our interns bring in really great ideas. We get to explore new techniques, and we also get to teach them a lot of cool stuff about neurologic music therapy and all the subspecialties of music. So we really get to stay at the front of what is happening in the music therapy world. I'm going to talk a little bit about music therapy inspired intervention. So this is taking what music therapy and music therapists have done and learning how to use it for a non-music therapist. So there are a lot of significant changes that are made to these techniques because a music therapist isn't facilitating it, but there are ways to use music for a clinician that's not a music therapist to be successful in sessions. Number one, we'll talk about lyric analysis and songwriting. So lyric analysis is really great. A way for a non-music therapist to facilitate this, and I emphasize the non-music therapist aspect, is to play music from Spotify or Apple Music or YouTube, wherever you want to get your music from, and ask your client what songs they like. Pick a song they like, play it, and then dissect it. The words, what it means to them, memories they have with it. All that stuff is really has clinical value, and it helps them be in the moment and really focus on what they're doing. The way a music therapist would facilitate this often is playing it live, and then taking a really deep emotional dive. We're trained to go through 3 different levels of subconscious, unconscious mind, and how to handle like triggers and traumas. But for a non-music therapist, it's a very great way to just surface level check in with somebody, is going through a lyric analysis of songs they like and what they are feeling in the moment, setting a theme, setting an intention, and going from there. And the same with songwriting. You take it a step further and take a song that they know and take out certain parts, change the words, and then just play it. A really easy way to do this for a non-musician that's facilitating it is to go on YouTube and find those like backing tracks to popular songs. So then the words are taken out. So then you can sing the new version with the changes without it being the original version, and then talk about that process. Always a key with these interventions is to process what you're doing. Intentional playlisting. This is one of my favorites, and I use this personally, and I always encourage people, especially those that are struggling through things or going through burnout phases of their life, which I feel like, we all do in every profession. Intentional playlisting is a great way to stay grounded and in the moment. How this would look for yourself is to kind of pick point A and point B, how you're feeling now and where you'd like to go. A lot of times when we're feeling agitation or anger or frustration, we try to put on something that's like complete opposite emotion, and that's a discrepancy. So that's it's hard to go from anger to happiness. It's a very big leap. So with intentional playlisting, we're not doing shuffle. We're putting songs that we like, we associate with certain emotions, in order, going to a place for purpose. So for me personally, I would maybe, if I was angry, I'd start with like death metal or something really, headbanging angry, and then I'd go maybe to like progressive rock, and then maybe I'd go to rock and roll, and then maybe I'd pivot it into blues or jazz, and I would slow it down, and I would take myself to the place that I want to be, as opposed to just putting the polar opposite genre or style of music that reflects something different for me. And how that would look with a client is taking songs they like, asking them and saying, hey, what do you associate with this emotion? And having them document those songs and then putting them in a specific order that you can use in a session with them, so you can take them from point A to point B, and encourage them to do that on their own as well. Because a lot of what therapy does for us in therapy is it helps us take those skills away so we can go home and do it later for ourselves. Drumming. So drumming is a great way to use a music therapy inspired intervention in any kind of session. Drumming is great for movement, for ambulation, for just improvisation, emotional processing. And if you just have a single drum, anybody can play it, and you just put on a beat and play to it. Silverado, we have an intervention we call Drum Fit. It's designed by music therapists, but it has been adapted for non-music therapists. So a lot of our directors of resident engagement at other communities have been trained on how to facilitate a drumming group that's not music therapy, but it's inspired by music therapy techniques. That's structured and has a design for emotional processing, communication, inspirational, deep dives into ourselves and what we're feeling in the moment, and discussion. That's a big part of it too. So drumming is a fantastic way to facilitate music therapy inspired interventions in a clinical setting. And then sing-alongs. So sing-alongs are something we all know. It's probably the simplest form of music therapy there is, but for a non-music therapy intervention, you're taking songs someone knows and playing it with them and maybe pairing it with an activity, maybe pairing it with something you're working on, but it's the fact that they like those songs, they've chosen those songs. When somebody chooses something, they take ownership of it. And so when you give them that opportunity in a clinical setting, they're more likely to participate in whatever you're doing. And that's a lot of what we see in music therapy. So these are just different kinds of techniques that I would recommend to a non-music therapist to try in a session if they'd like to explore some alternative ways of approaching things. Just want to piggyback off that, just as a music therapist, I like to just specify, make sure when using techniques like that, it's so okay to say it's music therapy inspired, but not to claim that it's music therapy unless you're a board certified music therapist who's trained in using it as a music therapist. So here's some of our resources. I talked a little bit about AMTA and CBMT and NMT, neurologic music therapy. AMTA is our governing body for most of our profession. It is a huge resource with a lot of information. It's the place to go to find music therapists, to make sure someone is an actual board certified music therapist, and to get a lot of good information on what music therapy is and how to use it. The Certification Board for Music Therapists, this is the body that regulates our certification. So everybody has to go through them to become a board certified music therapist, and they work very closely with AMTA. And then NMT Academy, Neurologic Music Therapy. This is the subspecialty training company that trains neurologic music therapy. Very evidence-based, a lot of great research out there. The cool thing about that course is that anyone can take it. You don't have to be a music therapist. So it's very informative. A lot of PT and OT take this because it really helps understand how to use that stuff in their sessions. And then Journal Music Therapy, JMT, I like to put this up there. There's so much peer-reviewed research on music therapy out there, like thousands and thousands of peer-reviewed studies with universities and various aspects in the music therapy world. But JMT is our official one that is associated with AMTA. So I believe if you're a member of AMTA, which you can be without being a music therapist, they have a non-member setup. You get access to this, and it's 50 years of peer-reviewed research within the music therapy world. And then to clarify again, there's a lot of non-JMT music therapy research out there, but JMT is just the one that's associated with our governing body. So I think they have it listed on Oxford University Press as well. If you don't want to go through AMTA, you can go through Oxford University Press to look at that research as well. And a lot of times, if anyone has access to university databases, all of these are in the university databases usually, and if not, they can get it. These are my references for the various aspects of music therapy we discussed today, and I will share this PowerPoint with Allison if anybody wants the PowerPoint. Thank you so much for having me. I really enjoyed being here. I hope you enjoyed the presentation and learned some stuff. And my favorite part is questions. I love to talk about this stuff. I could talk about it all day. So if anybody has any questions.